My purpose here this morning is to put on the table for public consumption and that of the media the facts surrounding the government's vaccination plan and our vaccination objectives. Because in this era of misinformation and disinformation, the government's vaccination plan is being misconstrued. It is being ripped apart and reconstructed by those who should know better to give a narrative designed to breed ill confidence or no confidence in the government's vaccination plan. And that is unfortunate. So I am going to go into some detail this morning of what is the government's vaccination plan based on policy and based on science and based on evidence. The government of the Republic of Trinidad and Tobago on September 18th, 2020, which is about 5 to 6 months ago, signed the COVAX agreement. That was the beginning back in September 2020 of the government's vaccination plan. In that vaccination plan, and this is where people are misconstruing the numbers, the cabinet note spoke to WHO's objective of using COVAX to vaccinate 20% of the world's population, or of the countries that signed up to COVAX, 20%, to end the acute phase of the pandemic within 1 year, or hopefully by the end of 2021. That is where that 20% comes from. The cabinet note went a bit further, that we will seek to source through COVAX enough vaccines to vaccinate 33% of the population outside of the initial 20%. So 20% is 240,000 persons. 33% is just over, I believe, 500,000 persons. That is what the cabinet note spoke to on COVAX. In addition, the current science speaks to a country that, or the world, if you want to achieve herd immunity, you must vaccinate somewhere between 50 to 60 to 70% of your population. This is outside of COVAX. We have said this consistently and clearly over the past few months. 20% is COVAX's initial target. The cabinet note also goes on to ask COVAX for vaccines to cover 33%, and herd immunity is somewhere between 50, 60 to 70% in that range based on the current science. Outside of COVAX, Trinidad and Tobago began formal bilateral talks on October the 1st, 2020. Note the word, formal bilateral talks. We were in preparatory talks before that. Before you can talk to a country or a vaccine manufacturer, they have to be willing to speak to you. So we were making approaches prior to October 1st, but formal talks began in October 1st, and they continue up to the present with countries and also vaccine manufacturers who to date have all told us they are not selling vaccines to third parties or private entities. They are only dealing with governments. Other approaches are being managed through the CARICOM Secretariat, which manages the African Medicines Council's platform. So that is the negotiations. What is TT's vaccination plan? Because commentators and certain opposition leaders are pointing to other countries that have started their vaccination plan and why we have not started as yet. We have said from day one that Trinidad and Tobago, as per protocol, will only be allowing into the country vaccines approved by WHO once they get EUL or EUA, which is Emergency Use License or Emergency Use Agreement. We must note that when we are compared to other countries that have started their vaccination programs, many of these countries, as is their right as sovereign states, are using non-WHO approved vaccines, and we could have absolutely no problem with that. So we are not comparing like with like, we are comparing apples with oranges. Let me reiterate, Trinidad and Tobago will only be using WHO approved vaccines, and we note that other countries have started their vaccination program using non-WHO approved vaccines, and that is their right as a sovereign state. The Trinidad and Tobago model for managing COVID by all objective measures has proven to be successful. We have saved lives, we have saved livelihoods, and we are a country where most sectors of the country are in fact open. The vaccination program, which Trinidad and Tobago has used for over 50 years in Trinidad and Tobago, has proven to be successful. And one of the key success factors in 50 years of vaccinating people is that people must have trust in the vaccine. This tried and proven method of using WHO approved vaccines has served us well for 50 years. You would have heard one of the nurses who was here a couple of weeks ago said, in her 10 years of administering vaccines, she has never had to fill out an adverse event form. And that is why I am confident that once we start to vaccinate persons on this tried and tested method for 50 years, it is going to prove successful. What are some of the constraints? How many vaccines have in fact been approved by WHO and when? Because these are the constraints now. Where are we now? The Pfizer vaccine, which was not originally a part of COVAX, we must remember that, and we have said that several times. The Pfizer vaccine got approval on December 31st, 2020. So as far as the COVAX facility is concerned, Pfizer has only been available 2.5 months. The Oxford AstraZeneca vaccine only got approval on February 15th, 1 month ago. And the Johnson & Johnson vaccine got approval on 12th March, 3 days ago. So I want all those who are intent on creating mischief and misleading the population, I'm speaking directly to the population now. The vaccines approved by WHO, Pfizer approved 2.5 months now, December 31st. Oxford AstraZeneca, which we are expecting in this country, on February 15th, only 1 month ago. And Johnson & Johnson, 3 days ago. So that is where we are in the lineup of having WHO approved vaccines. But the population also needs to understand, and we have said this before, that WHO not only approves the vaccine as per normal new drug registration process in Trinidad and Tobago, they also approve the sites of manufacture. The AstraZeneca vaccine is being manufactured in many plants around the world, United States, Europe, South Korea, and so on. WHO has only approved 2 sites under the COVAX facility for the AstraZeneca vaccine. So that's a further limitation. Those sites are the Serum Institute of India and SK Bio, South Korea Bio. It is our information that the vaccines we will be getting under the COVAX facility, hopefully by the end of March, are coming from SK Bio, the South Korean plant. The reason why I'm going into such detail is that the population must understand the due diligence that both Trinidad and Tobago and WHO engages in to make sure that the vaccines that we supply to persons to go into your arms are safe and efficacious. Let me repeat that. AstraZeneca has many plants around the world. I could source AstraZeneca vaccines today from many plants around the world. You would have noticed, although no link has been made, that some European countries have suspended the use of the AstraZeneca vaccine because of certain batches manufactured in Europe. But to date, there is no link, and that is good. But could you imagine if I, as Minister of Health, advised the government to bring in any vaccine from a plant that is not visited by and signed off by WHO, and similar concerns were raised locally? Whilst I know we are all anxious, and I am anxious, safety of our local population must trump expediency. What is our operational plan now to vaccinate persons once we get WHO approved vaccines from sites that are approved by WHO? Our policy is a stratified one based on persons having high risk and high exposure. So therefore, in the first instance, when vaccine supplies are limited, we will be prioritizing certain groups of individuals based on their exposure and their risk. This is the eligibility criteria we are going to use. It is the equitable thing to do. But before we go there, a vaccination plan operationally has to be based on where you are going to store hundreds of thousands of vaccines. If you don't have storage capacity, you can't vaccinate persons. I would have told the country late last year that we were going to build a chiller in Couva. I am happy to report I paid a visit, my last visit to Couva. I was there a couple of times during construction. I was there on Saturday. Construction has now been completed. And that storage facility can store 1 million doses of vaccines. 1 million. We never had that capacity before. This is part of the operational plan now. At C40, we can store 120,000. At the Arima Hospital, 120,000. At Point Fortin, 120,000. And at Tobago, 60,000. So we now have the capacity to store 1.4 million doses of vaccines in Trinidad and Tobago. That is no small feat. In addition, you must have the consumables to go with your vaccination plan. Right now, we have 1 million syringes in stock. We have another million coming in on April 30th. There are lots of moving parts to launch a vaccination plan. We have 1 million alcohol swabs, and we have printed an extra 40,000 vaccination cards. So when the vaccination process begins, all consumables are in place. So 1 million syringes now, another million coming in up in April 30th, and 1 million swabs. This is all in effect to put together a robust vaccination plan. To vaccinate people, I would have gone into some detail about 2 weeks ago. We have already identified 21 vaccination sites throughout Trinidad and Tobago. I wouldn't list each one. We have it up on the Ministry of Health's website. But just to remind, they are distributed amongst the 5 RHAs as follows. Tobago RHA, 3 sites. ERHA, 4 sites. North Central RHA, 4 sites. Northwest RHA, 2 sites, and we are looking at possibly more. And Southwest RHA, 8 sites. So your vaccination plan is predicated on having vaccines, having consumables, and having the physical sites. We have already begun the sensitization and resensitization of the vaccinators. That is, the persons to administer the vaccinations. And we are engaging more HR personnel. Our IT platform to manage this is up and running, and we have repurposed our hotline so that once we start to vaccinate persons, you have a hotline dedicated to that. Many people are asking, when will I be vaccinated? So, based on the policy, and everything must be driven by policy, science, and evidence. Based on the policy, science, and evidence, we are vaccinating people, as I said before, based on high risk and high exposure. So, in phase 1, which has begun to a certain extent with the gift from Barbados, we have vaccinated to date 1,113 or 120 frontline healthcare workers. But when we get in that shipment of 33,000 odd, hopefully by the end of March, we continue that. Then we vaccinate the elderly in the long-stay homes. We have already received permission from them to vaccinate roughly, I believe, 987 CMO, thereabouts. Let's just say 1,000 to round off the figures, because they are high risk, high exposure. And then we start to vaccinate those with NCDs, non-communicable diseases, because, as the science and the evidence will tell you, the vast majority of the 140 persons who have died have comorbidities like diabetes and hypertension. So you will get the most bang for your buck if you go after these 3 initial categories. In phase 2 of the vaccination plan, we go after essential workers, as I have indicated before. And the list is not exhaustive. I will just give you some idea who we consider essential workers. These are persons that keep the organs of state and the organs of the country alive and well. So frontline police, Coast Guard, Army, the teachers who are out, not all 13,000 teachers, but the teachers, high risk, high exposure, who are now out in classrooms, forms 4, 5, and 6. Immigration, customs, they interface with people, and so on. Parliamentarians, local government councillors, local government practitioners will be under the rubric of essential workers. And to show you how we make the distinction, I was on a radio program last week, and somebody was asking about security guards. High risk, high exposure. A security guard in a hospital versus a security guard managing a warehouse in an industrial complex, who is not exposed to the public. You would give your last dose to a security guard in a hospital setting versus a security guard in an industrial complex. So the principle is high risk, high exposure. And then phase 3, the public over 18, excluding for the present, because we don't have data as yet on persons under 18 and pregnant women. Trials are continuing with that. We have already identified some mass vaccination sites, and that is when we will engage NGOs like the TTMA and other NGOs to vaccinate persons in the public domain, regardless of risk and regardless of exposure. Now, if, as we expect, more and more vaccines become accessible to Trinidad and Tobago, as more and more vaccines are approved by WHO, and as the bigger countries vaccinate their local populations, therefore more millions of doses become available, if we get large amounts of vaccines, let's say 500,000 or 1 million, which we can store, then we may not go sequentially, but then open it up to the general public. So the vaccination plan is predicated on getting vaccines approved by WHO, manufactured in sites approved by WHO. As I close, I want to assure the public that you will always get true information from the Ministry of Health. I urge the public to ignore the propaganda being put out there. We at the Ministry of Health, we are ready and willing to accept WHO-approved vaccines so we could administer it in a carefully thought-out program so that you, the members of the public, could be assured of safety and efficacy. And I will give you the assurance now, we will not be engaging in shortcuts by bringing in vaccines that are not WHO approved or manufactured at sites that are not WHO approved. Shortcuts will not help us in the long term. It may make us popular in the short term, but we have your health, your safety as our #1 priority. So I hope we have given you this morning all the elements of a careful, well thought out, safe vaccination program. And Candice, I thank you.